Hello everybody and welcome to our virtual coffee with an OSCE educator. My name is Sarah Grant. I'm the Managing Director of My Healthcare Recruit and owner of OSCE Accelerator. We are joined today by the lovely Beth Vincato. Beth is a tried and tested OSCE educator. She's been teaching for over 5 years now. She has had literally thousands of nurses go through the OSCE and is a wealth of information. So we are delighted to have her with us. Essentially, we get lots of questions on our social media about the OSCE exam, and we really just wanted to dive in and answer some of those questions. So the topic of today's session is the clinical skill, removal of urinary catheter. So I just want to dive straight in and say, Beth, what can international nurses expect when they come in and they approach the removal of the urinary catheter clinical skill?
Okay, so good morning everyone, welcome. So for this station, obviously you're going to remove a catheter, a urinary catheter, so you have to remove it from either a male or a female mannequin. The thing you have to do for the exam, which we don't normally do so much in practice, I would say, is you have to give a lot of post-procedure advice and talk the patient through it very well.
Wonderful. And so you said you have to give them lots of advice. What kind of advice are you expected to give at this station?
Okay, so you need to say, according to the marking criteria, that they all have some symptoms, that they may experience some symptoms post-removal. Which, as we know, is quite unlikely, but this is something they like you to talk through in the exam. So these symptoms can be urgency, frequency, and discomfort. You also need to encourage the patient to exercise and obviously to drink more, as you know. So their guidelines is 2.5 litres. And we need to ask the patient to let us know when they've passed urine.
Got you. And is there any documentation required for this station?
So you're not actually required to complete any documentation, which is a plus, because it's only 8 minutes, but they will give you kind of like an introduction paper, which will tell you how much water is in the balloon. So it should be the standard 10 mils. If they don't give you that paper, you can just ask the examiner how much water is in the balloon.
Perfect. And so for someone approaching this station then, how would you recommend that they prepare effectively for it?
Okay, so I would say the most important thing is where I've had a few candidates slip up in the past is they weren't familiar with how our catheters are here. The ones they have back at home are a little bit different. So obviously if you're working in the UK, great, you know what they look like. But if not, please have a look, just so you're familiar with where you're going to remove the water from. So it's not the first time you come across it in the exam.
Sure. So practice makes perfect in that respect. And in terms of that practice, are there any common mistakes that you think that candidates can focus on avoiding?
Okay, so I went to a conference for OSCE educators a few years ago, and they said one of the common mistakes was not removing all the water from the balloon. Mm-hmm. So, you know, sometimes we can remove it and there's still water in there, and obviously it's not a real patient, so they're not going to tell us it hurts. So it is bad practice anyway. Make sure you've removed all the water. Also, as I said before, candidates not being familiar with how to use the catheter and just things going wrong with that.
Sure. So just as you said, being as prepared as possible in that respect. Wonderful. I think that's a really good oversight. Just to finish on, any top tips for this station?
I would say definitely, as I said, with all your stations, practice, get a friend or family member to help you, give them the marking criteria and get a timer going. And good luck.
Fabulous. Well, thank you so much, Beth. I think that was super helpful. A really good high-level overview of the removal of the catheter station. I'm sure that your wisdom will help some of our learners. So thank you so much for joining us, and we'll speak to you again next time.
Okay, thank you.